Hi, I'm Dr. Deepak Megur, and today we'll learn a little bit about the classical stop and chop technique and how to manage a dense cataract in an elderly patient. Now, she's a 78-year-old lady who has this mature brown cataract. The consultant is suspecting some amount of phacodonosis in this patient. So let me take you through some of the important steps in the course of the surgery. The first would be to create a rhexis in the right way, because in zonular weakness, I think we need to have a slightly bigger rhexis, which helps us in managing the nucleus very well. The second would be the nucleus management itself, because the nucleus is quite dense in this eye and it is going to take in some amount of effort to manage it in an atraumatic way. So with this insight in mind, I am having a plan to create a rhexis which is at least about 5.5 or bigger than that. Do hydrodissection using very little amount of fluid. This is what we call as a multiple quadrant hydrodissection. And then for a nucleus management in this case, I would just want to demonstrate a stop and chop technique. And I would be conscious to avoid anterior plane of emulsification, because that would be at risk of damaging the endothelium. So let's see how things turn out. The patient is a little bit anxious and sensitive to pain. I'm just giving 1 ml of posterior subtenance lignocaine. The incisions are made, the capsule is stained. The eye is pressurized with dispersive OVD. And now is the time to perform the rhexis. As soon as I puncture the anterior capsule, we can see that the lens wobbles a little bit and then settles down. I raise a flap, and then using the forceps itself, I'm creating a rhexis. Very mindful of the fact that I want to have as big as a rhexis as possible. So I have a very decent sized rhexis here. Now time to do the hydrodissection. Usually I avoid hydrodissection in white cataracts. Now because I'm expecting a slightly looser bag, I don't want the nucleus to be sticking out of the bag during rotation. So just to release its attachments, I'm using small amount of fluid at 2 different quadrants and then tap the nucleus and then ensure that the nucleus is mobile. So one trick to ensure that the nucleus rotation is atraumatic, and let me demonstrate the right way of attempting a nucleus rotation after hydrodissection. When you go in with a Sinskey hook or a chopper, always ensure that the chopper is at the mid-periphery part of the nucleus, that is nearing the equator. That is just under the rhexis or just near the rhexis, not in the center. When the instrument is placed at the peripheral part of the nucleus and then we attempt rotation, we require very little amount of torque energy, and this ensures that the nucleus rotation is done very easily and putting the least amount of stress on the capsular bag. One of the most common mistakes done by a beginner surgeon would be attempting to rotate the nucleus by holding it at the center part of the nucleus and then try to rotate. We can rotate by this as well, but we require a lot of energy to achieve the same goal. So always place the instrument in the peripheral part of the nucleus just near the rhexis margin. Push the nucleus a little bit posteriorly down and then rotate. Now this is least stressful way to rotate the nucleus in the bag. Time to do the phacoemulsification. Initially I'm just using the settings of the epinucleus mode to remove the superficial epinucleus in the cortex. And now I'm going to switch on to the sculpt mode. I just want to demonstrate the stop and chop technique, and this nucleus is of the ideal density to use the benefit of stop and chop technique. So I'm going to talk very basic here. So whenever the probe is moving down towards the opposite pole, the power is on, and when it's coming back, the power is off. It's important to ensure that when we press on the foot pedal, power has to be maximum when the tip is at the center of the nucleus, and the energy delivery has to decrease as we traverse towards the peripheral part of the nucleus. Now this is because the nucleus is thickest at the central part and the thinnest at the poles. So we don't want to go in with high energy as we are near the peripheral part of the nucleus, because we need to remember that the nucleus is a biconvex structure, and if you're using very high power near the pole of the nucleus, there is a chance that we can create a hole through and through across the posterior capsule as well. So the dictum is always try to use the maximum power when the tip is near the central core of the nucleus and reduce it as the tip reaches either poles of the nucleus. I'm just rotating the nucleus. Care is ensured that it is sufficiently deep enough. The central trench appears to be 80% in depth, and now I'm just placing these two instruments, the Phaco probe and the chopper, deep inside the trench, and both of these instruments are then moved laterally away. So the trick is to keep them as posteriorly as possible, just above the posterior plate, and then when we do lateral separation, we don't require excessive amount of energy. So in a very automatic way, you can just separate the nucleus, the fragments. The nucleus is rotated, and the lateral separation confirms that the two heminucleus are well and truly separated. And now I'm going to change the settings to the chop mode. Here the settings are changed. I'm going to use just the longitudinal energy to do the chopping. So remember, when we're sculpting, we're using just the torsional energy. Since the nucleus is slightly harder, I'm going to increase the power of the energy which I'm going to use. And I prefer to use it in a burst mode. A short burst of Phaco is given to engage the nucleus, and once the tip is totally buried, the Phaco energy is stopped, the foot pedal comes to position 2, and then the chopping maneuver is performed. The chopper goes in vertically down, and then there is lateral separation. So once one of the pieces is free, I just pull it out of the bag and then emulsify in the iris plane. And now I'm going to change the settings to the quadrant removal mode, where I'm going to use the torsional energy itself to emulsify this nucleus. The idea is to create some space so that now it's much more easier to move the nucleus around. Now back to the chop mode. Tip is buried into the substance of the nucleus. The nucleus is engaged and pulled up and anteriorly a little bit. The chopper goes down vertically down, and then there is lateral separation. The two fragments are then emulsified safely. Time to refill the chamber with OVD. The remaining heminucleus is then rotated and brought into the position where it can be chopped easily. Again, the Phaco tip goes in using short bursts of Phaco energy. The budding is done until the entire exposed tip goes in, and then the chopper moves down. As expected in these hard cataracts, it's not possible to achieve the entire crack in a single chop. So you need to make lateral separation maneuvers at least a couple of times until the posterior plate is separated. The final fragments are then being emulsified now. Again, it's important to ensure that there is very less amount of turbulence in the antechamber and lens chatter, and this can be achieved by using the delivery of Phaco energy in a controlled manner. So the energy is set in a linear mode, so the energy delivery is controlled by the foot pedal. And my second instrument is held above the level of the fragment so that some of the fragments which have a tendency to fly around and hit the endothelium can be minimized. So eventually all the nuclear fragments are emulsified. The customary PC polishing with the BSS is being done. It just separates all the sticky cortex to the posterior capsule and makes cortex aspiration quick and easy. The cortex is aspirated out from all the quadrants. So I do the posterior capsule polishing with the BSS one more time. Time to implant the lens. The bag is filled with OVD and the planned single piece intraocular lens is being placed into the bag. The OVD both in front and behind the lens is aspirated out. The wounds are hydrated. That's it, the case is done. So to conclude, I believe appropriate planning for each case is extremely critical. We need to anticipate. So what are the difficulties which we can encounter in that particular case? Then plan it accordingly. And because we are prepared well, the implementation will always be better. That was it. Thank you for watching and hope you found this helpful.